Now, let's get the latest on the pandemic and catch up again with Professor Catherine Bennett, of course, from Deakin University. Good to talk to you again, Catherine.
Hi, Chris.
The question I want to ask about this Sydney outbreak, and especially when you look at the numbers that are pretty steady despite a pretty severe lockdown, and when you listen to the rhetoric of both the Chief Medical Officer and the Premier, it seems that zero COVID is dead, right? No one is pretending that we're going back to zero COVID in New South Wales.
Oh, I do think it's actually very difficult to see us getting back to zero with the way this is tracking. I agree. I think as our vaccination numbers come up, we may see better control, and that might change things. We might then see the opportunity to close this down. But at this stage, despite best efforts, the mobility data, it shows that the lockdown's working, particularly as it's in Sydney, not the whole state. It's not doing quite as well at the state level as Victoria when the whole state was in lockdown, but you can actually see, how much this has reduced that movement. But it's still that connection between households, and that's, we would have had that in all our lockdowns. It's just with Delta, it finds every occasion, and you've got more virus in the community now. It's very hard to stop those incidental transmissions happening through small workplaces, through the household connections that just keep this thing moving on. So I think you're right. I think we're looking at this as being now something that is about containing it as much as we can, keeping it suppressed like we are, but also, really accelerating with the vaccines, which we're also seeing, which is fantastic.
Now, this is a serious situation and people have died. As I pointed out again at the top, especially a couple of young people have died in this outbreak. So, as you know, I take this whole pandemic very seriously. But I also get concerned about some of the hysteria and alarmism around. So I just want to put this to you. And that is, if this is the case, if New South Wales now is rolling out the vaccine as quickly as possible and then looking to ease back on restrictions gradually into the spring and towards the end of the year, then what's happened with this outbreak is not so much that it's a catastrophe, but it's brought forward by a couple of months the process that New South Wales and the whole of the country are going to have to go through anyway, right?
Absolutely. I mean, it's all about this plan, isn't it? That view that we moved from being focused on COVID zero, which sort of became a thing in the middle of it, even though originally the plan was just to hold off the virus until we could get to this point where we had vaccine and we could make it accessible to all Australians. And so now we're looking at a much better picture. We're looking at a timeline that's actually not that far off our original October timeline to try and get this vaccine out to everybody by the end of the year. So it's absolutely about this adjustment to knowing we will live with the virus, but you have to focus on containment. You don't want it to get out of control. And I think the Chief Medical Officer actually said it really well. He called it a soft landing. It makes all the effort we put in worth it because we've held off massive waves of cases and overwhelming hospitals and all those other things we're worried about. If we can just keep this vaccine rate going up, then that brings the end date closer when we can actually say, the vaccine's now doing the heavy lifting. We still need to do some public health controls, but we don't have to do anything like we're doing at the moment just to try and contain the outbreak and stop it from taking off.
Yeah, I think you're right. I think that's a really good way to express it, the soft landing. And the last thing we want to do is completely lose control now, but if we can steer to that soft landing over the summer, it'll be a great thing for this country. Thanks for joining us again, Catherine. I appreciate it.
Thanks, Chris.
Professor Catherine Bennett there from Deakin University giving us the lowdown on just what we're facing here as we learn to live with COVID in coming months. No one's saying this is happening suddenly, but in coming months, that's where the country is heading.